Okay, so good afternoon, everybody. First of all, thank you for this opportunity. So I'm Yuga, doctoral candidate attached with the Center for Medical and Health Science Education. Professionally, I'm a lecturer in medical education at Eastern University, Sri Lanka. Today, I'm going to explain my doctoral project, which is the running title of the doctoral project is Developing Flipped Classroom and Exploring its Effectiveness in Undergraduate Nursing Education. This project is supervised by Associate Professor Marcus Henning, Dr. Yan, and Dr. Matroria. This is the outline of today's talk. First, I will talk about a few basic concepts in flipped classroom. Then I will outline my doctoral study. Then I will summarize a systematic review, which I did as a part of my doctoral study. Let's move on to the background detail. What's happening in the contemporary nursing education? Globally, nursing institutions have attempted to redesign their curriculum to align with modern pedagogy. The curriculum reformation is mainly concerned towards fulfilling the educational need of the technological generation. Modern pedagogy is expecting to enhance student-centered learning. The blended learning incorporate several student-centered pedagogical approach. One of the blended learning blended learning innovation is the notion of flipped classroom. So let's see how this flipped classroom is different from the traditional classroom. In the traditional classroom, students are coming to the lecture and teachers sharing the information. Most of the time, that was the first experience students gaining the information. Teacher may give the home task to the students. Student will apply the knowledge, analyze and evaluate the knowledge in their own environment. According to the Bloom's theory, gaining knowledge is a low-order learning process. Applying the knowledge is a high-order learning process. In this traditional classroom scenario, low-order learning process is happening with the facilitation of the teacher, but the high-order learning process is happening in their own pace without any support. That's what flipped classroom came to the light of the education scenario. Here, teacher share the learning material as a video lecture. Student watch this lecture and coming to the classroom. Here, teacher will design the classroom as an interactive environment. Students allowed to analyze, apply, evaluate the knowledge in this attractive environment with the facilitation of the teacher and the support of their colleagues. This was finally defined by the Messeldin that it is a hybrid approach to learning, using technology to move the classroom lecture to homework status and using the face-to-face classroom time for interactive learning. Recently, I went for a focus group discussion with my colleagues. I encountered a common question, sharing the pre-reading material before the classroom, is that a flipped classroom? The definite answer, I got it from the meta-analysis from the BMC Medical Education, that the flipped classroom definition excludes the sole use of pre-classroom reading material as a form of flipped learning. The rule of thumb of the flipped classroom is that pre-learning, pre-classroom material should mimic the traditional classroom experience. With that basic concept, we will move on to my project-related information. Literature revealed that flipped classroom is a new educational paradigm in undergraduate nursing education, and also literature revealed many advantages of this flipped classroom that are: it fosters the self-directed learning, it promotes the critical thinking and enhances student satisfaction, and improve the students' engagement and promoting the motivation to learn and increase the student assessment marks. And also literature revealed disadvantage is mainly technological problem. Flipped classroom expect some sort of technical competency from the side of teacher as well as from the students, and also it's consumed preparation time for teacher as well as to the students. Comparing these disadvantages with the advantage, this disadvantage can be neglectable. So most of these findings were from well-equipped educational environment. This was supported by the meta-analysis. They recruited 28 studies of flipped classroom in the broad spectrum of health professional education, majority of the report from the USA. We found another meta-analysis which include 22 randomized controlled trial of flipped classroom in the Chinese nursing education. But I couldn't access any flipped classroom experience in the South Asian nursing educational setting. These educational context is quite different from the other geographical location in terms of teaching learning practices and resource availability. Therefore, as a health professional educationist from the Sri Lanka, I would like to investigate this flipped classroom experience in the undergraduate nursing education setting in Sri Lanka. Therefore, I formed a four research question for my doctoral project. What are the feasibilities available for fostering flipped classroom? What are the existing pedagogical model available for developing flipped classroom, and how can a flipped classroom model be developed? What are the difference between traditional classroom learning and flipped classroom learning, and what are the post-interventional perception of stakeholders on the flipped classroom? These research questions were, to answer this research question, we design our PhD project into three phases. Phase 1, investigate research question 1 and 2. Phase 2, investigate research question 3. And phase 3, investigate research question 4. And also we set up the deadline for each phase. We have completed the phase 1. We are on track. But phase 2 and phase 3 may be affected by the COVID restriction. But however, with the hope, we are running with the original plan. So to answer the research question 1, I went for the baseline survey, which include focus group discussion and questionnaire survey. To answer the research question 2, I did a systematic literature review. Today's presentation mainly focus on the systematic literature review. In another occasion, I will share the baseline survey results. Let's see what happened in the systematic literature review. We used PRISMA guideline. We formed focus research question for these specific for this systematic review, that are what is flipped classroom, how can a flipped pedagogical model be developed, how well does it work in relation to the undergraduate nursing education. And also we form inclusion exclusion criteria for this review, that are we include all the flipped classroom experience in undergraduate nursing education. It's important to note that I set up the review period, the search period between 2012 to 2019. Hugh and Lowe, in their meta-analysis, they revealed that flipped classroom was introduced into the health professional education in 2012. And we formed the search algorithm with the help of the Boolean operators. This is the search strategy, sample search strategy in Medline. Finally, we did a literature search on 7 databases and got 1,263 papers after the step-by-step systematically exclusion. Finally, we got 27 papers for evidence synthesis. The evidence synthesis was done in this data extraction table. Here we got information regarding the details about the authors and methodology, and we revealed the research design and key finding, conclusion, and the description of flipped classroom, and categorizing the evidence. And one more thing I couldn't display here, we also find out how these studies relevant to my doctoral project. So this is the results of our systematic review. Most of the studies from USA. In here also, I couldn't find any flipped experience in the South Asian region. My dear friends, we couldn't find any flipped classroom experience among the nursing education. We couldn't find any detail regarding the New Zealand as well. It is over to you. So we did a quality appraisal by categorizing evidence, the tool which was developed by the Eccles et al, and the tool was remodified by the Jensen et al. So according to the categorizing evidence tool, most of our evidence is reached 2B category and above. And interestingly, all the evidence were categorized under the operational rank A. It gives the quite credibility to the studies. So we used inductive thematic analysis approach to analyzing these extracted data. We got 37 codes which were categorized under the 4 themes, namely knowledge and skill, student attitude and perception, pedagogical structure, teaching and learning strategies. Interestingly, in the systematic review, we found a model for developing flipped classroom. It is a popular instructional system design model, AE model. It was developed by Center for Education Technology at Florida State University. The model has been recognized as effective and efficient in designing the flipped classroom in nursing education. The model explained the pedagogical development by 5 straightforward steps. First step is analyzing the feasibility for adapting new pedagogy. And second step is designing the instructional strategies. Third one is developing teaching learning material. Fourth one is implementing this pedagogy. Last one is evaluating the implemented pedagogy. I decided to use this model as a framework for my PhD. So this is the correlation between this AD model and my doctoral study. So the analysis step was investigating the phase 1, design, development, implementation was investigating the phase 2, and evaluation was investigating the phase 3. And also we common operational model was reported in all the 27 papers. The operational model was explained in 3 steps, that is pre-class activities, in-class activities, and post-class activities. Pre-class activities started by sharing the learning material to students from the teacher desk. It was happened at least 1 week before the face-to-face class. It's mainly done through the online learning management system. The nature of the pre-learning materials, any form of videos such as video lecture, narrated presentation, or video demonstration. The duration for this video is 10 to 20 minutes and vast range of software used for developing this pre-learning material. In our systematic review, there was 3 softwares reported, namely Explain Everything, Articulate Storyline, and Camtasia Studio. The pre-classroom was end up with the formative assessment. The quizzes is a main form of the formative assessment. In-class activities, teachers divide the students into a small group. The reported group size was 2 to 6. Teacher conducted diagnostic test, that also mainly through quizzes. The in-class activities were followed by the student-centered learning approaches, such as problem-based learning, scenario-based learning, team-based learning, simulation, and other sort of things. Post class is focused mainly about follow-up discussion regarding a newly emerging issue of the learning concept, and some of the study reported that teacher conduct a post-test as well to assess the overall learning experience, and some of the study reported they conduct a student survey for evaluating the effectiveness of flipped classroom. And also influence of flipped classroom on nursing student learning also reported in this systematic review. So 7 studies reported about the student satisfaction. 4 studies reported that the flipped classroom increased the student satisfaction. Meantime, a study revealed that nursing students still prefer the traditional classroom. It is important to note that student satisfaction was dropped in the initial period of the introduction of flipped classroom. Later on, it shooted up. It is interesting to note that students with the kinesthetic learning style, they satisfied with the flipped classroom. Students with the visual and auditory learning style, they less satisfied with the flipped classroom. And also flipped classroom increased the skill development. Above mentioned skill were developed through this flipped classroom. And also 11 study reported that the flipped classroom influence on the assessment score of the students. 7 studies reported it was significantly improved the test score, and 4 studies reported it does not influence on the test score. And also 4 studies reported that flipped classroom observed as enjoyable enjoyable way of learning. It's mainly student has enjoyed with the video lecture rather than the live lecture. And also flipped classroom increase the self-directedness and student motivation, student engagement, teamwork, and critical thinking. And also challenges also were reported in 5 studies. Mainly they focused on the preparation time. Flipped classroom assume it's consumed more time for preparation. And however, one study reported that educators found it worth to deposit the time. And also technological challenges was also reported. It's mainly about the creating the quality video. A study reported that the following should be overcome while developing the pre-classroom learning material. That's a poor sound quality, mismatch between the audio and visual element, and also lengthy video caused less engagement between the students. And the delivery of pre-learning material also a challenge, because as I told you earlier, the pre-classroom material should be shared with the students before 1 week of the face-to-face class. Late delivery causes a negative impact on the effectiveness of flipped classroom. And also initial dissatisfaction also reported in this study. So we should have a solid and constant plan to overcome the challenges. Infrastructure also observed as a challenge to implement this flipped classroom. The study was reported in 2019, but after the COVID scenario, I don't think this is a challenge, because the new normal education practice greatly emphasizing the blended learning. So with that, the summary of the systematic review as conclusion: flipped classroom pedagogy yield promising positive educational outcome in undergraduate nursing education. A common operational flipped classroom structure was reported as a pre-classroom, in-classroom, and post-classroom. There are instructional system design model available for adapting or developing a flipped classroom. These are the reference for today's talk. Thank you so much.